Welcome, I'm Town Administrator Andy Sheehan. Welcome to the first video of 2021. This is the week of January 18th, 2021. I hope everybody had a joyous new year and happy holiday season. Obviously, the biggest story of 2020 was the coronavirus, COVID-19 virus, and that's hanging with us, still with us as we embark on 2021. It is just a year since the first case in the United States of COVID-19. That was on January 20th of 2020. So we're beginning our second year. We've seen a surge in cases in the last couple of months as we've gotten out of the warmer weather and gotten into, as we've moved inside, and then holiday gatherings and other things. So it's a bit of a grim picture. We're at about 400,000 deaths in the United States. And so, there's a reason for some despair, but I think there's also clearly reasons for optimism. There are a number of pharmaceutical companies that have come up with vaccines in short order. They've done remarkable work to develop vaccines in such a short period of time. Those are being administered now to first responders, and then other at-risk populations will be next, and eventually the at-large population, the generally healthy population will be able to get those vaccines. So it seemed like a good opportunity to bring in Derek Fullerton, our health director here in Middleton, and talk to him a little bit about where we've been, or more importantly, where we are and where we're going. So Derek, welcome. Thanks for joining me today.
Thank you.
Quickly, where are Middleton's numbers right at the moment?
Sure. I'll just start off with first, thank you, Andy, for having me, and thank you to the Middleton residents for the diligence and the safety we're doing in our community. We're all doing a great part, and I just personally want to thank you all for going through this journey together and trying to get us out, out of this locally, nationally, and globally. But thank you, first of all. With the numbers, Andy, last week, the public health report that the Middleton Health Department puts out weekly, as of 1/15, we had 1,019 cases within the community. We do distinguish on our weekly report. We break it down with our at-large community, which is our general population, and we segregate it out with our jail population to give more kind of a local feel of what's in the community. And out of that 1,019 number, we had 557 at-large, and the jail had 462 cases. As of present day, today, January 19th, we've received 5 more cases since 1/15, and the jail is seeing another little surge. We have 35 cases in the last 4 days that have come in from the jail, bringing our total number to present at 1,059. So those are some numbers. The good thing I just wanted to share with the residents is that in the last few days, or in the last 2 weeks, we are seeing a decrease in numbers on average. If you look at our 7-day average over the last 6 weeks, week 6 in December, we were at about 7.4 cases a day. Then another week in December, we're at 8.1 cases a day. And then the last week in December, we were about 8 cases a day. And then starting in the new year, we had a little increase due to the holidays and gatherings. We're at 11 cases a day. But as of the last 2 weeks, as of January 9th through the 15th, we're at 3.5 cases a day. And to present, we're about averaging 1.3 cases a day. Now that is just based off a few days, so that could go up a little bit. But we are seeing some good optimism in the numbers, and getting past these holidays and in the travel and in the gathering. So our hope is that we continue to go down.
That's good. That's good. So I mentioned the vaccine, the development of the vaccine, and the rollout of that. Do you view that as the light at the end of the tunnel for COVID?
Yeah, I would say it's definitely the light in a dark season that we've all been in. Whether or not it's the light at the end of the tunnel, how long that tunnel is the question. We will have some things that we will have to do as a society and as a community, until we get out of this pandemic, and, locally, how we get out of a place where we have, a high percentage of herd immunity, or another term is population immunity, until we know that there's not much transmission in the community, that we're protecting the others that aren't able to receive the vaccine. So once we get to that point, I see that as the true light at the end of the tunnel. But it is great positivity, great step in the right direction. Typical herd immunity would be caused by either infection or by vaccination, or the combination of both. With this type of disease, we don't want infection because of what we have seen, the mortality in certain populations. So we want it more through vaccination, through the population immunity. So that is definitely a great step in the right direction, having the vaccination planning and phasing coming out. And I do see definitely a light in the darkness as part of the vaccine being available.
Good, good. So you and your colleagues in Topsfield and Boxford recently held a first responder vaccination clinic at the fairgrounds. How'd that go? Is that successful?
Yeah, it was extremely successful. Give a great shout out to Topsfield for taking the lead on this, and collaborating like we always do as a tri-town, all the way back to H1N1, gave us some great foundation to where we are now. But it was great. We were able to vaccinate over 3 clinics, about 600 first responders in the categories that fall under first responders, whether it's EMS, police, fire, constables, etc. We were able to vaccinate 600 people within our 5-town collaborative. We also have 2 other towns involved with our regional efforts of Hamilton, and I believe it's Wenham, as the 2 other towns. So 600 people in our first 3 clinics was very successful. You help with our Medical Reserve Corps. People that are watching this, if you want to volunteer, you can sign up to the Medical Reserve Corps, and you can find that on our town website, and you can help out in those vaccination clinics. But very successful first efforts.
That's great. That's great. So the state is setting up what they're calling mega vaccination sites throughout the Commonwealth. The one down at Foxborough Stadium is getting a lot of attention, obviously, because can accommodate a lot of people in that site. We received some good news last week, and then a little bit further good news today about a mega site. Can you talk about what the situation will be for Middleton residents and North Shore residents?
Yes. So the State Department of Public Health reached out to us. Andy and myself and our first responders met with our collaborators in Danvers, and we met with the State Department of Public Health, and they announced that we were going to have a mega site, a high throughput vaccination clinic that will reach most of the groups through the entire phasing right here in our own town of Middleton at the Doubletree Hotel. Don't call the Doubletree Hotel if you're watching this. They're not involved with, in terms of registration and when you can receive your vaccine, et cetera. But it is a great effort because they're bringing in a very large company that has the ability, the manpower, the resources to get a very high throughput per day. They estimate anywhere between 3,500 to 5,000 people per day that can be vaccinated. And that's great for the town of Middleton, but also the county of Essex. You're trying to set up one of these types of mega sites in each of the counties. And fortunately for Middleton, we have it here in a good location that can handle traffic well with Route 95 and Route 1 and not affect our local community, but also a great benefit to the local health departments that, are still working on a surge in contact tracing and have to pivot to vaccination to be able to, these clinics to be able to handle some of these high numbers of the populations that we have to handle. So more information to come. We're going to be very involved, Andy, myself, in the town of, when the groups are announced, when they can go to those certain phasing, those through the clinics. So I know people are anxious to receive the vaccine. We're getting many calls each day. Just be patient. We, as soon as we can get the information out and as soon as we can get you vaccinated, that's our #1 goal. So we're not going to be hiding anything. We're not hiding any vaccine. We're getting it out but this mega site clinic will be a great solution to help us locally and regionally.
Yeah, that it really was welcome news. So I know that the site is going to be operating for about 4 months once it starts up. Supposed to start up before the end of January and run into at the DoubleTree at least until beginning of May or later, and then maybe a transition to another location. So a lot of people to vaccinate. Obviously, with most of these vaccines, it's a double dose. There's a vaccine and then a booster a couple of weeks later. So looking a little bit ahead, once people are vaccinated, or particularly once they get the second vaccine, the booster, can they take the masks off and sort of go back to where they were before and not worry about social distancing, or do those things stick with us?
Yeah, it's a great question. It's actually a question I've been asked by some people in the healthcare settings that have already been vaccinated their second round. And I had to do a little research on that. And according to the Department of Public Health state website is, even if you've received your second dose and have received your phasing of immunity, you're still expected to wear your facial coverings and do your social distancing, because the science and the data for the long-term immunity is still being validated and still being tracked. So although we do expect great things to happen with the vaccine, since it has gone through Operation Warp Speed in terms of being approved and implemented, we still have to establish a historical track of how long immunity is going to be and how much immunity is going to be established, et cetera, until they come out and change that facial covering and social distance requirement. So the short answer is yes, we're still going to have to do those things. It's going to be a very challenging thing as local health and local government to deal with individuals, but we just ask the residents to do their part. And we have a lot of other people that still have to do it that aren't able to receive the vaccine. So in honor of them, it's a simple task to just make sure that we can move through this in a peaceful way.
Okay, great. So we know that there are folks that maybe are reluctant to get the vaccine. They have a general aversion to vaccines, or they're worried about side effects, or they don't trust the science. What do you say to folks who are concerned about the vaccine?
Right. Yeah, I mean, we typically go through this in flu season in general every year. Obviously, we're at a much higher level of, seriousness with the COVID vaccine. But, based off what the information that I've read and the information that's presented federally, statewide and locally is that, they have gone through rigid levels of testing, rigid levels of checks and accountability. The FDA isn't somebody that just opens the door and looks the other way. The FDA knows they're going to own this vaccine, meaning own everything related to the approval of the vaccine for a long time. So there's no looking the other way to try to get this done in a way that would jeopardize people. Same as how the flu vaccine comes out. And each year we have to have a new strain done for flu vaccine because it variates, right? Flu vaccine, just because we're used to flu vaccine, we think that it doesn't go through, it's been around forever and it takes forever to get approved, but has to go through the same rigorous process because there's genetic shift and genetic drift and variations of the flu vaccine that we always have to go through these quick turnarounds on investigating the efficacy of vaccines. So personally, I feel comfortable with it. Professionally, definitely feel comfortable. I'm gonna get it. But obviously there are populations and people out there that do have reactions. Go to the DPH website. It tells you that people that should or shouldn't get the vaccine, people with shellfish allergies, et cetera. And if you are concerned, ultimately you have the right. This isn't a forced vaccination. It's not a mandatory vaccination. It's a voluntary vaccination. But the more people that we do get vaccinated, the more population immunity that's going to establish, and that light at the end of the tunnel we're going to see sooner. But in general, there are some populations that can't get it. We know that children depending on the Pfizer or the Moderna vaccine, either 16 or 18 year years of age cannot get it because they're still dealing with research on that. And so, the people that can get it, I encourage you to do your own research, feel at peace. And if you feel at peace with it, get the vaccine.
Good. Yeah. And I regularly get the flu shot, and I have every intention of getting this vaccine as soon as I'm able. I'm in the sort of the vast general population. So when I can get it, I'll get it. So
Right.
just quickly wrapping up about the mega site. So this is not a walk-up site. So you don't just show up and think you can get in line. How are people going to find out more about the hours and when they can go, and how do they register and all of that?
Yeah, it's a great question. So in general, besides healthcare settings that do their internal population of people, any general group in any phase of the pandemic, of the vaccination, will have to register through a site called Prep Mode Registration. And it's a site that's developed by the state of Massachusetts for this specific purpose in general for vaccination for COVID. So me, for instance, when it's my time, or Andy, when it's your time, you'll go to this link and you'll register on a very simple online registration form that asks you your name, what group you're in, etc. Upload your insurance card, and you'll be given a time slot within that grouping to arrive at either a mega site, or if it's a local clinic or a regional clinic, whatever clinic you're going to, you'll have to register through this prep mode. Now, we do understand there's some gaps related to the internet, so we're going to be talking locally with our senior center and our senior consult and aging director to try to help individuals that may not have the ability to use the internet, and maybe a call-in center that will help them register when that group of phasing needs to register to go get vaccinated. So there are some things we'll work around, but ultimately, as a community, Andy, myself, and other town officials will be populating our town website with direct information from the mega site. And it'll probably be a pass-through link that will go right there, and it will announce what phase is open at this time. And if you meet that phase for that grouping, then you can register to go there.
Okay, so we'll have just for residents at home who are wondering about PrepMod and how we get that information to you, we'll have that through our website. We'll send that out through an e-blast. So if you're not registered for e-blast, you can do that through the website, middletonma.gov, and then you'll get notifications as things like this come up. Otherwise, you can always just check periodically with on the website and find out information that's available. So, Derek, thanks for joining me today. Great information for the residents, and it's I'll stay optimistic, and I think there's a lot of reason to be hopeful about where we are, but we've still got a ways to go. But I think where we are now is a heck of a lot better than where we were 3 or 4 months ago.
Yeah.
So.
Thank you. This is definitely a step in the right direction.
All right. Thanks, Derek.
Thank you.
So thanks again to Derek Fullerton for joining us today. So this week, in a sort of different direction, this week we mark the transition from one president to another. It's been happening every 4 years or 8 years since George Washington left the office in 1797 and turned over the keys to the White House to John Adams. Interestingly, and this is not something that I knew until recently, Washington was not affiliated with any political party. The only other unaffiliated president was John Tyler, who left the Whig Party in the 1850s, I think, during his term of office as president. So the party landscape was a lot different for the first 80 years of the Republic. Parties that we don't have anymore were common. We had the Federalist Party, we had the Democratic Republicans, the National Republicans, the Whigs, the National Union parties. But since Andrew Johnson in the 1860s, every president of the United States since then has been either a Republican or a Democrat. It just is, nothing profound about it. It's just sort of an interesting historical note. So with that in mind, and in light of the serious challenges that the new president and the new Congress have before them, I'll share a quote from the former chairman of the Joint Chiefs of Staff, Colin Powell. I shared another quote from Powell a couple of months ago. He's a bright guy and admirable guy. So I thought this one was appropriate for the situation that that the country faces right now. And it goes like this: just as they did in Philadelphia when they were writing the Constitution, sooner or later you've got to compromise. You've got to start making the compromises that arrive at a consensus and move the country forward. And I think what Powell is saying is that he recognizes what the framers had in mind when they created the Constitution, that it was not intended to be a all far right or far left form of government. It was intended to appeal to the broad middle, and I think that's what he had in mind when he made that quote. And I hope for that going forward that we can find a little bit of peace in Washington. I think it would help everybody. So thanks for watching today. The plan is that my next video will focus on the development of the fiscal year 2022 operating budget. Fiscal 22 starts on July 1 of 2021. So we're working on that now. We'll have some information on that and how we go about that process, where the revenues come from, where the spending is centered, and hopefully you'll find that interesting. So stay tuned for that. As always, please email me any topics that you'd like me to discuss, or any other individuals that you'd like me to talk with or involve in these videos. You can reach me at andrew.sheehan@middletonma.gov. Thanks as always to Paul Paliselli and Adam Stone from Middleton Public Access for producing this video, and thanks for watching. And until next time, be safe and be well.